Hello, you guys. Here is our question of the day. Another NCLEX style question, and I love doing these. I don't think you can do them enough. It's always good to practice. So let's just get right down to it. A client has just been admitted to the nursing unit following a thyroidectomy. Which assessment is the priority for this client? Now, our number one test taking strategy is to repeat the question. Do that before you drop down to the answers because you want to start recognizing cues in your question. You want to get the subject matter. You want to get all the significant data so you can have that in your mind, be focused on that, review and know what the question is asking you before you drop down to the answer choices. Answer choices. A client has just been admitted to the nursing unit following a thyroidectomy. Which assessment is the priority for this client? Now we've picked up our cues. Recognizing cues is just picking up the significant data in the question. This client. And the reason why I highlight a client is because I want you to always remember to be aware of your patient, your client. Is it an adult? Is it a pediatric client? And they will tell you, if they just say a client, you can assume it's an adult. But you do need to know if you're taking care, if this subject is about a adult client or a pediatric client, because things apply differently, right? Following a thyroidectomy, and we're talking about priority assessments. So ectomy equals surgical removal. So thyroidectomy is surgical removal of the thyroid gland. And here is a picture of thyroid gland. Notice where it's located in the neck area. That should give us some clues. In the neck area, that directly puts your mind on airway, right? Um, They could have total thyroid gland removal, partial. We don't know, but it does not matter. We know that they have had total or partial thyroid gland removal. So we can go on to what do we do for post-op thyroidectomy? We're thinking about respiratory distress. We're thinking about, do we want this client flexing his or her neck? No, we want to avoid that. What about talking? Now, we're not telling them they cannot talk, but we want to limit talking because they're going to have some hoarseness. When they talk, they will be hoarse just because they've had surgery in this area. Dysphagia, we want to be looking at their swallowing, and if they have difficulty swallowing, we're thinking about thyroid storm. We want to keep them in semi-Fowler's position. We don't want them laying flat, right? They just had this surgery to their neck area. We're thinking about airway. We don't want them lying flat. So we're thinking about all these post-op interventions for thyroidectomy. Oh, yes, and remember, assess the back of the neck for bleeding. Always remember that with thyroidectomy. That's one of those things they like to sneak in on you sometimes, just so keep you on your toes. But think about, they do have this surgical incision there. They probably have a dressing there. Um, Blood may be running to the back on the pillow behind the neck. So it may not be, if you just look straight at them, that you see some drainage. So you need to assess the back of the neck and make sure that they're not having more bleeding, right? Or any bleeding. You need to notify the doctor. So sometimes they sneak that little assessment in on your questions, and your answer choices. So that's just something to be aware of. But because of this location, we definitely want to be thinking about ABCs, airway, breathing, circulation. That's priority, right? Now, let's look. We got our information. We've recognized our cues, and we've analyzed and we brought our nursing knowledge to the forefront. Let's go over the answer choices. So A was hoarseness. Well, hoarseness, we do need to monitor that, but that is expected after thyroidectomy. They may have some hoarseness. So that's an assessment, but it's not necessarily a priority if they're hoarse. Hypocalcemia. Now, hypocalcemia, why are we even thinking about hypocalcemia in thyroidectomy? Well, it's because the parathyroid gland could have got removed, could have got damaged. Parathyroid, calcium, if it's not working properly or was removed, they're going to have a lower calcium level. Hypocalcemia, that comes with its own bag of symptoms. So we do need to monitor that because they had this thyroidectomy and it could be related because of the parathyroid gland. So we do need to monitor that. But it may not necessarily be a priority assessment. We have to put it to the test of whatever else is going on in our answer choices. Now, our next one is audible stridor. Now, audible stridor is wheeze or whistle in airways, and it's caused by blockage. So, red flags, bells, sirens should be just going off in your mind when you see audible stridor about thyroidectomy, question, audible stridor, airway blockage. That's setting off all kind of alarms, right? But let's just check out this next answer, which is edema at the surgical site. Now, edema at the surgical site, we do need to monitor that. It's possible that they can have some edema. It's possible they may have a little bit more edema after surgery, but edema is one of those things that we know they're gonna have some edema because they had surgery there, just because the trauma to the skin, the location, they may have some edema there. So in comparison to these other answer choices, that's not the highest priority, right? Just like they can have hoarseness, but that's not the highest priority. Our highest priority is going to be that audible stridor because it's airway breathing. Airway breathing, when you're trying to find priority answers, if your answer choices, your situation relates to airway breathing, then you know that's your priority right there. So, audible stridor is our correct answer. We have eliminated the other answers because we know our ABCs, airway, breathing, circulation, those answers trump any of the other answers when we're talking about priority. And that is as simple as it goes when you are going through your questions. Again, you want to recognize and analyze your cues, bring your nursing knowledge to the forefront, and just go through those answers. The more questions that you do, the better off you will get. And remember, as you do questions, you will go through this process a whole lot faster. I'm just breaking it down just to show you really the process of how you use your cognitive skills to answer these NCLEX style questions. Well, that's it for now, and I will see you guys next time. Bye bye.